Okay, so to start our AY this evening, we're going to start with a lovely and lively song service. And our first lively chorus will be What a Mighty God We Serve.
What a mighty God we serve. What a mighty God we serve. Angels bow before him. Heaven and earth adore him. What a mighty God we serve. Fire, mighty God we serve. What a mighty God we serve. Angels bow before him. Heaven and earth adore him. What a mighty God we serve. Fire, 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 fire fall on me. Fire, 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 fire fall on me. On the day of Pentecost, fire fall on me. On the day of Pentecost, fire fall on me. I feel like pressing, I feel like pressing, I feel like pressing my way. I'm on my way to glory, and I feel like pressing my way. I know I'm pressing, I know I'm pressing, I know I'm pressing my way. I'm on my way to glory, and I know I'm pressing my way. I am under the rock is higher than I. Jehovah guide me, I'm under the rock. Go tell my enemies, I'm under the rock. Jehovah guides me, I'm under the rock. Jesus' name so sweet, Emmanuel name so sweet. Jesus' name so sweet, Emmanuel name so sweet. And every rock we rock upon Jesus, Jesus' name so sweet. And every rock we rock upon Jesus, Jesus' name so sweet. Okay. So we're going to end our song service this evening with As a Deer. As the deer panteth for the waters, O my soul, longeth after thee. You alone are my heart's desire, and I long to worship you. You alone are my strength, my shield. To you alone does my spirit heal. You alone are my heart's desire, and I long to worship you. Okay. To keep the body in healthy condition, in order that all parts of the living machinery may act harmoniously, should be a study of our life. The children of God cannot glorify him with sickly bodies or dwarfed minds. Those who indulge in any species of intemperance, either in eating or drinking, waste their physical energies and weaken moral power. Christian Temperance and Bible Hygiene, page 53.
Since the laws of nature are the laws of God, it is plainly our duty to give these laws careful study. We should study their requirements in regard to our own bodies and conform to them. Ignorance in these things is sin. Please stand for the AY emblems. Aim, The Advent message to all the world in my generation. Motto: For the love of Christ compels me. Pledge: Loving the Lord Jesus, I promise to take an active part in the youth ministries of the church, doing all I can to help others and to finish the work of the gospel in all the world. Song. Far we from every land and sea, together we pray and work and play in happy harmony. We have a faith to share with others everywhere, a message of love from God above to show the world we care. Adventist youth, Adventist youth. Please be seated. So for today's AY, I have some special guests with me today. They are my batchmates from our final year group at NCU under the Department of Dental Hygiene. And their topic for today is Teeth Talk, a dental health education session. So I would like you to give them your undivided attention and to pay attention to everything that they have to say. And I hope that you'll also enjoy the program that they have in store for you guys today.
Good afternoon and happy Sabbath, everybody. We are delighted to be here with you as we do just a little teeth talk to, share some information, educate the congregation that is here on oral health. So for this afternoon, we want you to pay very, very keen attention because there's an activity at the end that will require you to put the knowledge that you have gained into use. So be sure to pay attention. If you can, jot it down in your phone, jot down your notes, so that when the time comes, you are able to use this information to participate in our group activity. So to begin our program, we'll have a little icebreaker by Mr. Danor Anderson, and after which we will go into flossing by Miss Kayla Ray Leslie.
All right, happy Sabbath, everyone. It's a pleasure to be here. I'm Danor Anderson, and as we begin, we'll be doing a little interactive activity. So, if we are familiar with this game called 4 Picks 1 Word, we should be able to do this activity. We know that game. It's normally downloadable on the phone. We know 4 Picks 1 Word? Some persons know it. So, the instruction is that we have 4 pictures, and from these four pictures, you will use them as clues to find what the word is that we're trying to hint at. All right? Everybody understand? Yes. Okay, good. All right. So what we're going to do, you're going to think about it. You're not going to say it out loud. Probably jot it down on your phone or on a piece of paper. You're going to guess what it is. We're going to go through them. And then at the end, we're going to reveal the answers. Yes, so I'll give you, not the end of the presentation, once we have gone through all of them. Right, so just write them down. Those are some apples. Right. Something like that. And another hint that you can use to guess the word are the number of dashes that you see underneath. Alright? Alright. So has everybody gotten it? Sure. Alright. So, yeah, you know that one? So that's a roll of thread up at the top, if you're not sure what that is. And there's something between that guy's tooth, between the teeth of that guy, all right? And the word has 5 letters. Mm-hmm. Yeah. Remember, don't say, don't say, don't say. Write it down. Yeah, 2 words. Mhm. That's the only one? Alright. Alright, this is the final one now. Mhm. Yeah, that's some water in a container. Yes. Yeah. Has something in his mouth. Bottom left? That's that. Oh, the left. Me don't know left and right. That one is somebody washing. Yes. Um. Yeah. So he's mesmerized by some sweet scent. Ready? Ready to get the answers? Sure. All right. All right. So what we have for number one? Sure. Mouth. Oh. All right. Let's see. So the answer is bite. All right. All right. I want one of these two youngsters or the youngster beside you to answer this one, the next one. What do you have for this? What do you think this means? Floss is the word. All right. So, youngsters, please tell me what this one is. Nobody else talk for now. Cavity? All right. Good, good. Cavity. All right, sir. All right. Somebody help me with this one. Bad breath. How you know that? How you know that it's bad breath? Hmm? His face? Yeah. All right. Let's see. You are correct. And the final one now. Mouthwash. All right. Anybody? All right. That's it. Thank you for participating. On to the next segment.
So everybody knows what a floss is? Yes, you know how it looks? All right, can somebody describe it for me? You want to come?
It's kind of like what you like thread, but instead of thread, it's you put it in your mouth, and it it has some sort of flavor on it, and it has like a plastic kind of texture.
Yes, good job. You want to answer? All right, give him the mic.
It's like a thick string with minty taste on it, and it has a string, and it has a either a stick, but it's shaped like a C, and there's a green
Good
stick
job.
at the bottom.
Good job. That is a type of floss, and both of you are correct. So flossing, the purpose of flossing is to get rid of the food in between our teeth, because when you brush, you don't get rid of all the food. And there are different type of flosses. So first we have the floss pick, which is what he was mentioning. You can see it up there. Yes, it is very convenient and it's very easy to use. So the persons who normally use floss pick are persons with very tightly packed teeth. Yes, yes, that is right. People with dentures. Next we have the Next we have the interdental brush and yarn. And yes, you can floss with yarn. And the persons who would normally use that one are persons with wider spaced teeth. because the floss, because it's so thin, it won't be able to get rid of all the food that's stuck onto your teeth. So you need something that's thicker, and that would be the yarn or the interdental brush. So how would you choose your interdental aid? So as I said before, persons with tightly packed teeth, you use a regular floss or the floss pick. And persons with wider teeth, you use the yarn or the interdental brush. But if you wear braces, you're going to need a floss threader because you're not going to be able to get the floss in between or underneath the braces. So you use a floss threader, you push it between your teeth, you push the floss in it, as you can see in the picture there. So the blue thing that's going between the teeth, that's a floss threader. Yeah, like a thread, a needle. And then you put the floss in it, then you pull it through. But that is only if you wear braces. It is a lot of work, but you have to get out the food. And why would you need to get out the food? Anybody knows? Right. Right. It also decays the teeth. And we don't want that to happen. Oh, you want to answer? Where's the mic?
So your teeth don't get yellow.
Yes, that's true. That's true. So yes, the flossing helps, along with brushing and using the mouthwash that other persons will talk about, helps to prevent cavities and decays and also bad breath and dry mouth. So how do you floss? Give this side to me. You take the floss, put it between your fingers. You don't have any demonstration right now? Okay. You want to demonstrate? Demonstrate while I talk. She go demonstrate while I talk. All right, so we're going to allow her to demonstrate first, and then you can come up, okay? All right. You can hold.
So you need about an arm's length of floss.
Well, to your elbow.
To your elbow. To your elbow. And you're going to wrap it around both fingers. And you're going to hug it onto your teeth in like a C shaped. Everybody seen? So you hug it onto the tooth because the food is stuck onto the tooth. So you need to hug it, the floss onto the tooth in a C shaped. Carefully go down into the gum and pull up. And then you do it again in the same space but for the opposite tooth. So you go down in the same spot twice. Continue. All right. So she's going to go down, hugging on to the tooth, come back up, then to the next tooth, go down in the space, hug again, and pull up. You saw it? All right, you want to try now? All right, I'll hold it for you.
So Ivana is going to demonstrate for us how to floss. Can you tell us what you're doing while you're doing it?
You remember first how to start? Remember how
I'll
to start?
talk you through it and you do it. That's okay? So wrap it around your finger. Wrap, wrap, wrap.
And then you push it down
Wrap,
between
wrap,
the teeth.
wrap.
Hug it onto it. Hug, yes, and go
Give it a
down and come back up. Nice. And then you do it to the next teeth. The same space, yes. Hug it onto the next one. Pull it up. Right. Good job. Anybody else want to try? All right, come.
Can we give Ivana a round of applause?
You can explain?
What's
Or
your
you want me
name?
to help you?
What's your name?
What's your name?
Rayburn?
Wait, Barrett.
Ray Barrett.
Wade.
Barrett.
Okay. Alright, explain what you're doing.
I'm pushing deep into the teeth and making a C shape. I'm and pulling it out.
Mm-hmm.
Then the next teeth.
Put it in the same space. And then next, yes, and hug it onto the opposite teeth. Right. Put it down and pull up. Good job.
Can we give Ray a round of applause?
Thank you. So that is essentially flossing. And now we will move on to toothbrushing.
Why are you saying, oh no? So, how many of us in here brush once a day? Only once. Okay. And how many of us brush twice per day? At least twice. Twice per year? Twice per year. Times you should be visiting us to get your teeth cleaned. Twice per year. Every 6 months, you come in. We give it a good scrub down for you. Clean off everything. You're good for next 6 months. Not you must still brush your teeth daily, twice daily. Go ahead. Which dentist you go to? True. Let me tell you something. While we're at it, at Northern Caribbean University Dental Clinic, we are so gentle. And so I would recommend you guys come to give us a visit for a pain-free mouth. When you're all done, you can go back to eating same day. No soreness, If there is supposed to be soreness, we will let you know beforehand. That was a long time. I figure as much. Okay, so for toothbrushing, most people use a hard toothbrush, and the most common thing we hear is that it just feel like it brush it better. Damage your gum. Damage your teeth. Damage your gum. All right, let me give you guys an example. You know push broom that I use outside? And you know house broom that I use inside? You ever carry a push broom inside to sweep your floor? All right. Why? Because push broom is so rough. It can't get in the corner to clean out everything. Right? It's the same thing with the hard toothbrush and the soft toothbrush. The hard toothbrush, it's so rough. Every time you touch your gum saying, what is this? Right? And your gum start receding. That's why I see your teeth start looking longer. Your gum start receding. And for the soft toothbrush, it can get all into the little nitty-gritty, all in the spaces to clean out the plaque the right way. Go ahead.
What if you use the medium?
The medium toothbrush, it's still a little hard, But if your hygienist or your dentist says, because for some people, not in most cases you need a soft toothbrush, but for some people, they would recommend a medium toothbrush, but that is only in special cases, and you need to go to your hygienist or your dentist to get a recommendation. But for the general population, we recommend the use of a soft toothbrush.
So question, I love a firm toothbrush.
Pardon?
I love a firm toothbrush. I ask for only firm when I'm in the store. So the feeling I get when I use a softer brush, that it's not cleaned, is that a mind
All
thing?
in your mind.
Oh.
No, I don't need a wire brush. I use that to clean steel. All right. So the toothbrush, my lady. Oh, she's not here. She went out a while ago. That's all right. Yes. So you have three types of toothbrush as far as I'm concerned. The soft one, the medium, and the tough one, they call
Yes,
it,
tough.
the push broom. No, when I almost forgot the question because you went away. Oh, yeah. No, that if you're saying that for the general population, it should be a soft brush. Why is it that we have so many dental association and the folks who are making these toothbrushes? Why they don't? But you need, if you can educate the population and tell them don't buy them, they will have to stop making. And this is the same thing with the little skimpy clothes that the people making, because they are getting sale, they are still making them. So because people are buying these toothbrushes that are not good, the dental association then should, liaison with the manufacturers. They will still make toothbrushes and they will still make money, but they don't have to make those tough ones because they are dangerous. It's like you're drinking acid. So it is removing your gum from your teeth. So it's like acid in your mouth, removing the gum. So the dental associations, and you have a lot of them, not you? Yes, man, liaison with the manufacturers.
And on top of it taking away your gum and your tooth surface, the harsh reality of our society and the economic, is that they make money from it, and they will continue to make it as long as there are people who are buying it. Yes, and so it is up to you to know that this is not good for your teeth or your gums, and so you need to switch to a softer toothbrush. If the population was going for the soft toothbrush, they would go out of business. Yes, and it's so cheap. So they continue to make it, and they will make money from it as long as they continue to make it. But it's up to you to prioritize your health and the health of your teeth and your gums to say, I'm not going to buy it, I'm going to buy a soft toothbrush. Go ahead.
The hard toothbrush is not only used to brush teeth. They are used to clean surfaces.
Right.
Like those guys that you see going to school. They have two toothbrushes in their back pocket. One for the left foot, one for the right foot.
Right.
So if I know that the hard one, they use it to scrub down the bathroom floor. Like you're going to do tiling and those things. So you find out, so they continue manufacturing for those in those products.
For the clean up, we have brush to do that. For cleaning up shoes, we have shoes brush.
Go ahead.
The reason why we don't want the soft, as I say, we don't get no satisfaction, is we're doing it too hurriedly. Take your time and brush at the amount of time or the appropriate time,
2 to 3 minutes.
and you will get your
The
well-done
results.
job. But if we're in a hurry, as we're always in a hurry, so we think the little soft brush not doing anything to use the hard one, only irritate your gums.
Yes. Yes, and also if you have this amount of buildup on your teeth that your toothbrush is not taking off, you know what that means? It's time to come and see us. Yes. And of course, you're not going to wait until you feel that buildup because, you're good citizens and you're going to come and you prioritize your health. So you're going to come to us every 6 months to get your dental cleaning. Of course you are. I'm going to close my eyes because I don't see you shaking your head no. And yes, so if I can't see, then I don't know. So I'm saying yes. Every 6 months, we look forward to seeing you guys. So why do we recommend the use of a soft toothbrush? It is more effective in cleaning hard-to-reach areas, as we were telling you, the soft house broom, and easily missed areas like near the gum line and in between the teeth, which is where we typically see the buildup, right at your gum line and in between your teeth. So it's important in coordination with your toothbrushing that you also floss to get all the food out. Did you know that when you don't floss, you miss 40% of your mouth? And that's a whole lot of mouth to miss. 40%. Yes.
Another way you can think of it is that it's like when you wash your behind and you don't wash in between. We don't want that. It's a similar thing. Think of how many in-betweens are in your mouth. So you can think of it like that.
Also, it is more effective for those with braces and other orthodontic appliances. So, of course, if you ask Jessica, I'm sure Jessica uses a soft toothbrush with her braces. Anybody else have braces? No, okay. You have braces? Okay. We talked about it before, tooth abrasion, that's when you rub it and it start breaking down the surface of your teeth. You don't want that. Gum recession, your gum start going away, going back, towards your jaw. Yeah, so your teeth appear longer. Also, what we find is that for a lot of the population, they tend to scrub. So even with a soft toothbrush, they scrub. Yeah. You're guilty from childhood, right? So we find that in vigorous brushes, over vigorous brushes, people that really, really scrub, it does less damage when they scrub and use a soft toothbrush. But we don't want you guys to be scrubbing away your gum and the surface of your teeth. So take your time. It is getting the work done. Yes, it's coming right up after this. And of course, it's more effective for those with sensitive gum. Go ahead.
The shape of the toothbrush, does it matter? The shape. Yeah, 'cause these days you have some big head and some little. Some of them are flexible, while some of them are firm. I mean, the handles, of course. So, does it matter, or is it the bristles that matter?
The shape is typically a rounded toothbrush. Not like this cartoon toothbrush, but so the head goes,
You typically want a toothbrush that is relatively round and smaller so that you can around. Oh, the cord. Hearing me now? All right. So, do I need to repeat, or you heard? Okay. So you typically need a toothbrush that is more rounder in shape. Not that it is totally circular, but you want it a little bit more rounder, not rectangular. So I don't want to call out any brands now, but the ones that we have in the plastic cases. Those, yes, you notice how the national toothbrush of Jamaica, those are normally square or rectangular. Those are not necessarily helpful. We want the rounder ones, like those other ones. I don't want to. Okay, all right. But you get the picture. Yes. All right.
So you should brush twice per day. Do you know when to brush? Go ahead.
When you're going somewhere and you brush in the night when you're going to sleep.
Perfect. Give Ivan a round of applause. Go ahead, Wade. Hold on, Wade.
You brush in the morning, you brush in the evening, and you brush in the night.
Awesome. That's good as well. Give Wade a round of applause, please. Okay, so you should brush in the morning, even if you're staying at home. Brush still, right? Because we don't want that plaque to accumulate on your teeth and harden. Yes, and the breath. So we brush twice. Yes, man. You see that cornmeal porridge looking thing on your teeth? Brush it away. We don't want it to harden into a stone-like thing we call calculus. And also before you go to bed. And after you floss and brush to go to your bed, you're not supposed to eat anything. And if you eat anything, you floss and brush again. No harm, no foul. Go ahead.
Yes, I think the toothbrush
Yes, man, we're hearing.
makes a difference because I learned after a while that you have to brush the jaw, you brush your gum. Not only
Your
brush
gum,
the teeth, yeah, up and down, and from a dentist.
Okay.
So the proper toothbrush, the other toothbrush kind of damaged. Can I use one and it bruise up my gum around here? So I have to stop. Yeah, so I have to stop use it and use the soft one that the dentist said should use.
Okay.
And it makes a difference. Because we don't go just brush your teeth and so brush in the corner and say brush the gum and clean it out.
And your tongue. Awesome.
Yes, and your tongue. Yes.
And of course, you only brush and floss the teeth that you want to keep. So if you have no interest in keeping your teeth, okay.
No, you have, because I've seen some mouths. You know that from the day the mother take out that rag out the mouth, no toothbrush or anything go back into them. And they have all the teeth.
You think so?
They have all the teeth, but I don't think they're good. All the teeth are there, but looking at them, they're no good.
So you want the teeth that are not good in your mouth?
No, I'm not saying that. What I'm saying is, if you never brush and you still have all 32, and if you were brushing, some would have gone.
Okay, so let me tell you about that.
Why I'm saying that is because, as you said, the toothbrush help to wear away
The hard toothbrush.
the hard one. With the hard, yes. With the hard or soft, it's still taking something off. Yes?
The soft one take off the plaque, which is what we want to come off.
And it is very inner. But anyway, what I'm saying is, you're saying, according to you, what you're saying, you're supposed to brush after each meal, right?
In the morning and in the night, not necessarily during the daytime.
But I'm saying, if say, all right, I'm using myself. I like to use myself because sometimes you call somebody and they fix. But I am brushing once per day. And my teeth still look, say, better than a person who is brushing 3 times because of, no, I'm just using an example. You understand? And because I say I floss after every meal, but I don't brush after every meal. The other person might brush after every meal, but don't floss. But when you look between the teeth, they're deadly. It's like a accident waiting to happen. So I'm saying it's not so much the brushing, but the flossing. Because you can easily wash out what is on the outside, but what is between the teeth makes a big difference. You're shaking your head, Mom, but what is between the teeth makes a big difference. So if you don't floss what is between the teeth, that is what is going to cause the damage to the teeth. So if you brush 3 times and you never floss, you brush your teeth 21 days for the week and you never floss 1 time. There are a whole lot of build-up between the teeth, don't it? Yes. So I'm saying, I floss 3 times per day, but brush once. It still make a difference. Because the folks who don't floss none at all will not have the teeth that I have, or the good teeth that I have.
All right, so I understand what you're saying, but sometimes when we eat, I don't know have we brushed our teeth since the last time we had a meal today? Yes. No? For those who, you brush during lunchtime? For those who did not brush during lunchtime, could you do this for me? Just rub your teeth together. Does it feel firm or does it feel chalky, in a sense? Chalky? So a lot of the times when we eat, the acid can soften the enamel. And if you're feeling that chalkiness, that's what has happened, and that is what makes decay easy. So we have to brush. Because when we brush, and she will talk about the toothpaste, it helps to mineralize or reharden the tooth so that it doesn't feel that chalky. So when you brush this evening when you get home, try doing that again and see if you feel a difference between now and later.
And also to address something that, what's your name, Brother Clark? Brother Clark said, he said that sometimes you see these people that don't brush have all their teeth. So what we find often in practice is that dental calculus is what is holding the teeth in place. So when we go and clean this is plaque that has become hardened. Yes, hardened as stone. And this is the only thing. There's no bone there. It's the only thing holding this tooth in place. And as soon as we go in to start cleaning that calculus off, the teeth just coming out. Right? And so to prevent that, we brush and we floss daily. We brush twice a day and we floss once. And the truth is that you need to brush to get the plaque off your teeth. Okay, so how do we brush our teeth? Using our soft toothbrush, we want to, you can focus your attention to Mr. Anderson. He'll be demonstrating. So for the outside of our teeth, which is the part that we see when we smile, all of that part going around, we want to place our toothbrush at that angle. This one first. Okay, yes. And then we slant it to a 45. At a 45-degree angle, and we want to ensure that some of the bristles are, reaching beneath our gum line to brush away, and he's going to give it some gentle strokes. So he's giving it a vibrating motion to, agitate the plaque so that he can remove it. And you do this for each section of your teeth. And you want to make sure that the sections are overlapping as you do them, because you don't want to miss anywhere at all. For the bottom, it's the same thing in the opposite direction. So you're doing the vibrating motion, ensuring that the bristles are reaching beneath your gum line, brushing upwards to remove the plaque. Also, be sure that you see this inside, the part to your tongue. People always forget to brush inside. So make sure that you're brushing inside to remove it. For the top. And of course, the top surface of the tongue is a bacterial habitat. And the tongue cleaning reduces the number of organisms, thereby controlling bad breath, improving your taste perception, and contributing to overall oral cleanliness. So we clean your tongue so your breath don't smell, your mouth is healthier, food tastes better. Yes, just like that. Of course, this is the way you clean your tongue. Down motion, brushing it all away. So really, the mechanism for cleaning your tongue is not as specific as the mechanism for cleaning your tongue. The way that you're doing it is correct. We don't have a tongue, but you can show them in the tongue space. Yes. That way. Give. Right. One direction. Mm-hmm. Because we don't want to be pushing the food that way, the plaque that way. So we want it to come this way. Off. Yes. And make sure you get in the back of your tongue. Also, if you can't reach there, we recommend the use of a tongue scraper, which will remove the plaque, the build-up from off your tongue. You know tongue scrapers? All right, so tongue scrapers. Yes.
At the back of it has this thing that they're saying that you use. No, man, not necessarily seal. That you use to clean the tongue. Is that the best, or is there a specific tool that is used?
There is a tool called a tongue scraper, but in the event that it's not readily accessible, you can always use a spoon. A spoon, right at home, at your fingertip. Just this spoon is just for your tongue. So you're not going. I don't have a spoon. You just use it to scrape. Okay. So in the meantime, we'll move on to cavity prevention. Miss Jayla Francis will be talking to us a little bit about cavity prevention. And when the spoon comes, we'll show you. Go ahead.
How long?
So to clean your teeth properly, it's 1 to 2 minutes. Typically 2 minutes, but the average person only takes 30 seconds. So you want 2 minutes to brush your teeth. And it takes about 2 minutes to floss. Okay, so for demonstration purposes, of course, you know it's a smaller spoon, a teaspoon. This is your tongue. Hold the spoon this way, where the bend is inside. Scrape it that way. Remove the plaque. Towards, this is the tip here. Scrape the plaque that way, and they build up. Yes.
Happy Sabbath, everyone. Today, I will be talking to you about cavity prevention. So I'll give you the foolproof steps to cavity prevention. But first, before we go into the steps, can anyone tell me what causes cavities? Yeah, you can skip them.
You don't brush the teeth properly.
Yes.
By not brushing your teeth well. Like eating food and then you don't brush your teeth and you don't floss it.
Very good.
Good. Give everyone a round of applause.
Wow, wonderful. Cavities. Yeah, okay. All right. So, some wonderful input from the children. But let me add some more. What causes cavities would be when you eat sweets, not just sweets, sugars, so carbohydrates, because they turn to acid on our teeth. Your bread, your biscuit, your bola, your bun, everything. It turns to acid on your teeth, and when the sugars turn to acid, it causes 20 minutes of acid attack on the teeth, which weakens the teeth surface. And as Mr. Danor Anderson said earlier, you get that chalky feeling because the surface become easy to break away, to wear away. So, can anyone tell me how to prevent cavities? Okay.
By brushing your teeth and flossing.
Okay, that's the answer. Okay, that's really good. All right. Yes, that's a good answer. Let's go into the foolproof steps. So first, brush your teeth twice a day. Yes, let's have our answer.
You can prevent getting cavities. You can prevent getting cavities by brushing your teeth and flossing. Go to the dentist 2 times per year
Wonderful, wonderful. Okay. So, brush your teeth twice a day with fluoride toothpaste. This is because fluoride remineralizes the tooth surface. So when you get that chalky feeling on your teeth, the fluoride comes in and it hardens the surface of your teeth. Yes. Question. Mike, please.
Isn't fluoride poison?
Okay. Yes.
Is it fluoride poison?
Okay. So, as a precaution, do not swallow the toothpaste and pay close attention to children when they're brushing so that they don't swallow the toothpaste, because children tend to eat toothpaste, and then when their adult teeth start to come up, you will see like these white brownish spots. It's called fluorosis, and it's due to overconsumption or excess intake of fluoride during the developmental stages of the tooth formation. All right. Okay.
Okay, so it's not that fluoride is poison, because it's not poisonous. The point that you need to address is that when you eat too much of it, right? For example, like the kids eating it, right? That's what causes the problem. It's not that it's poisonous. The only thing is that if you do an overconsumption of fluoride, is that it can make you feel sick, right? So it's not that it's poison. Yeah. And it's in natural foods and stuff as well, like in milk. So, yeah, but fluorosis in of it in itself is not poisonous. It's just overconsumption of it can lead you to feel sick. That's all. You want that?
Okay.
Okay.
Can I have a
Thank you.
question?
Yes.
All right. So I realize the emphasis is placed on fluoride toothpaste,
Yes.
right? That's the recommended type, or that's the standard.
It's the recommended type of toothpaste, but not for children under 2 years of age.
Why I ask the question is that there are different types of toothpaste on the market, as you know. We have not necessarily the herbal ones. At one point, I fell in love with there is baking soda. Yes. But I find that it does something to my my lip inside here. It seems to strip it. Yeah. So I love, because it has the texture of it seemed to clean my teeth. So I thought better. But I just stopped using it. So that's what I'm asking, if the fluoride is the standard toothpaste that we should use and nothing else.
Okay, so fluoride toothpaste is the standard one. That's what we generally recommend, mostly because of the components of the fluoride have to remineralize in the enamel on the teeth, right? When you mentioned that you say use the baking soda one, right? Usually what we say to patients is that they shouldn't use those types of toothpaste because they're quite abrasive. Right, that's what we usually tell them. So we advise, okay, just don't really use that one because the fluoride is going to be more beneficial for you. But in more recent studies that some dentists and stuff have done, they're saying that baking soda isn't actually as abrasive as we thought it was. So I think the general conception is that people use it too much. So it's not that it's extremely abrasive, it's just that people use it too often. So you have to kind of use it in coordination with the fluoride. Yeah, so you can like alternate. So you don't use too much of the baking soda one, but you use the fluoride one. Yeah, maybe like once a week you use the baking soda one or something. Right, you just don't use it often.
Yes. Another thing that we should consider is that fluoride, the mineral, the element, is a natural part of our teeth. You want me to stand? All right. So fluoride is a natural part of the teeth. When your teeth are developing as a baby, fluoride is a part of what hardens and makes the teeth what it is. When you eat, as Jayla will explain, that is lost, and so you need something to put it back. Right? And Jayla will explain how that is done.
Just add, we should, Jessica explain that is excess consumption that is bad. I mean, and the reason I'm emphasizing is because it's a big thing on the internet that I came across, discouraging people from using fluoride. But we have to understand that even water can poison you. Yeah, man. There's a thing such as water intoxication. You can read it up, right? Something that we can't live without can still kill you. So it is a matter of excess. We have to be careful how we run with conspiracy theories. Understand the thing properly.
So, is there a type of toothpaste that you can find fluoride in? Is there a type of toothpaste that you can find fluoride in?
Yes, fluoride toothpaste is widely available. Yes, you can ask your mom and dad to ensure that the toothpaste they're buying has fluoride in it by reading the labels on the toothpaste.
Also, for the theories that you were talking about that you came across on the internet, those are, as you would have said, conspiracies. They're not proven. We're not saying nay, but we're not saying yay either. They're not proven by any reputable, sources. So we don't run with those theories. And also for the consumption, the excess, as adults, we don't swallow toothpaste typically. Yeah, so we don't go about swallowing the toothpaste. But in babies, we don't want them to swallow it. That's why, as Jayla said, under 2 years old, we don't encourage the use of fluoride toothpaste in those babies because the risk of them swallowing it is much, much higher. So we use the baby toothpaste for them. So, in case they swallow it, they'll still be okay. And then when they're grown enough or their understanding has developed a little bit more, so you can say, baby, spit it out, and they will spit it out. That's when they can go ahead and start using the fluoride toothpaste.
There's this thing that I came across that suggests that you should not rinse your mouth after you brush.
Yes, that is true, so that the fluoride has time to absorb onto the tooth surface and and it's more effective that way.
So we just brush and spit.
And spit.
So no rinsing of the mouth.
No. Until 30 minutes.
If we're using a fluoride mouthwash, then so brush, spit, wash off the outside, clean up yourself.
Yes.
But all right, that's new. That's news to me.
You mean you spit and you go?
Yes.
I mean,
Yes.
you don't rinse at all?
No.
Okay, let me stand up and tell you. Okay. So, like we said, you just brush, spit it all out, right? Because like Mishka said, we don't just swallow everything in the mouth, yeah? So we just spit everything back out. Unless you're using a fluoride mouthwash in combination with that, you don't rinse out your mouth with any water. And you don't rinse after your mouthwash either, because I realize that's very common, because they say, oh, there's something about me. And then they'll rinse it back out. You're ruining the process of remineralization. You're wasting the mouthwash. You're wasting it. So you just have to let it sit there and take its time to be absorbed onto the teeth. Yes.
Okay. All right. So next we move on to flossing.
What about the
Yes.
Sensodyne?
Pardon?
What about the Sensodyne toothpaste that the dentist recommend? Is it can be too much?
Okay, with the Sensodyne toothpaste, with those are really specifically catered to people who have extreme sensitivity. So that's really who those types of toothpaste are made for. There's a component in the Sensodyne toothpaste, not necessarily fluoride, but it's potassium something, I can't remember the end of it, but it's some type of potassium ion that they put into it to help with the sensitivity. So it's not necessarily the fluoride helping with the sensitivity alone, but another combination in with the Sensodyne toothpaste specifically. And other type of sensitivity toothpaste brands. So once it's specifically catered for sensitivity, they usually have a potassium ion type of chemical in there.
I'm thinking though, it's making more sense now because that's why it's recommended that we use the fluoride toothpaste, which is milder, Because if I should use the baking soda toothpaste and not wash out, a problem.
Yes.
You understand? So yes. So I'm understanding why you recommend. It's been recommended that we use the fluoride toothpaste.
Okay. So as was spoken about before, flossing is very essential for cavity prevention because the food will be not only on the surface of your teeth where you can brush away, but it will also be in between your teeth. And often we see people with caries in between their teeth, cavities in between their teeth, and it's because of the lack of flossing the area.
So I don't really flush my teeth, but I don't really floss my teeth, and I don't know what to do, so I just use the one that my father uses. I use the one that the pig. I don't use the other one, but my teeth are wide. So I don't know what to do. I didn't know what to do, so I just used that floss.
Okay. So, for widely spaced teeth, there are interdental brushes available. So it's a tiny bristle brush that you can use to get the spaces in between your teeth. Okay. I will show you a picture of the interdental brush afterwards. Yes, question.
I'm in trouble right now. Because when I brush, I gaggle. And that is water. So how gaggle. So how that go?
So you're saying that you would not be comfortable with leaving the toothpaste? Just spit until the uncomfortable sensation stops. Don't rinse. Yes, I understand. After a while of doing it, you'll get you accustomed to the feeling. You get accustomed to the feeling.
I have a question.
Yes.
So when the 30 minutes up, do you do the same with the mouthwash? Because when the 30 minutes up, when you use the toothpaste in your mouth. But
You can use the fluoride mouthwash right after you brush your teeth and not eat or drink for 30 minutes afterwards.
So it's the same with the mouth. So it's the same with the mouthwash.
You wouldn't have to wait 30 minutes to use the mouthwash. Yes.
So, is mouthwash actually really important? Cause me and my parents don't use it.
Okay, so the question was, is mouthwash that important? Okay, so mouthwash, yes, it is actually very important because you have properties in the mouthwash that the toothpaste doesn't have. So, for example, when you have like the burning sensation after you use a mouthwash, that's actually the mechanism of it killing extra bacteria that you probably didn't get a chance to take off when you brush and floss. So the mouthwash is very important in killing bacteria. Oh yes, and it also gets around the rest of your mouth, like the palate and then the back of the tongue and on your cheeks and all of those. Yeah, everywhere the toothbrush can't go, the mouthwash will get it. And it'll kill all the extra bacteria that's left there. So yes, mouthwash is very important.
Can I ask about the recommended recommended mouthwash?
That's the answer.
All right. Let's go. Oh, another question? Okay.
Actually, I got in when when the argument was going on about not
Spitting.
not washing your mouth
Yeah.
after brushing your teeth.
Yes.
No, I am not sure how that works because I'm a woman like this. I always like to go and have those whole squirting business going on in my mouth. So I'm seriously allergic to mouth. So I washed a lot.
So to combat that, if you're uncomfortable with the feeling, you can use a fluoride mouth rinse after brushing. To
Oh, so
rinse
just
out
brush,
the
then
toothpaste.
use the fluoride rinse instead of
Instead of gargling
putting
with
the water.
water.
Oh. All right, got it. Okay, now.
Yes. Okay, so let's move on. Watch what you eat and drink. This is a very important component in preventing caries because a lot of us Jamaicans tend to have a diet filled with sugary foods, sweets, starch. It's the snacks that are available in the schools, the biscuits, the sodas, and they really wear away the tooth surface like that because, as I explained, the sugars convert to acid, which destroy the tooth surface. So you want to have a diet with more natural sugars, fruits, vegetables, water, meat, coconut water. Avoid the sugars. And if you are to eat sugary foods, brush immediately after. Or rinse with water immediately after.
Okay, so we can, because I was going to ask, right? I'm on the road. We're on the road. And, you know,
Have your
we
water
going.
there with you to rinse.
So we just, so rinsing is sufficient until we get home and we can brush, right?
To brush,
All right,
yes.
cool. Question at the back. What about sugar cane? If what's happening with that one? Because we understand the fiber
like
is
natural
there,
sugar.
and we have the sugar there. How it work?
All right. So sugar cane is processed into sugar, right? But the processing, you need loads and loads of sugar cane to make a bag of sugar. So it's not as concentrated as the processed sugar. That's why I stick to natural foods with natural sugars. All right, let's continue. Okay. Yes.
So when you're sick and you have the mouthwash, what do you do when you can't breathe out your nose?
Yes, gargle.
You can hold your breath. Try hold your breath now. All right, let go now. You all right? You see okay? So you see with the mouthwash, you just gargle. And then when you feel like you can't go anymore, spit it out.
You said we have to wait a little bit.
So the 30 minutes is before you eat to give it. Oh no, it's not 30 minutes in your mouth, you know. It's just a 30 seconds. Just a quick washer, less than a minute. Just a quick wash around to, get it everywhere and then you spit. So even if you can't breathe, you just wash it around, swish it around really quickly, for about 30 seconds or until you feel like you can't go anymore. Then you spit it out.
But when you don't, but won't it just why won't it? Will it help your teeth if it's not so fast?
Okay, so doing it fast while you're sick is better than not doing it at all. Okay. So visit your dentist regularly because, hold on until the end of this. So because you want early detection of the dental cavities, you need to visit your dentist so that they can prevent it from progressing into a worse state. Because
when you have the dental caries, it can cause infection of the tooth pulp, which cause your face to swell up. It's cause abscesses and infection. In conclusion, cavity prevention is essential for maintaining good oral health and a beautiful smile. And now we'll move on to periodontal disease.
All right. What is periodontal disease? That's a good question. I hear somebody asking that already. Anybody know what gingivitis is? That is a manifestation of gingivitis, but gingivitis is really when bacteria infects your gums. All right? So, Jayla, well, that's when it's really bad. That is when it is really bad. But Jayla mentioned before acid attack on the teeth. Before we get into period, I just want to add to what she was saying. So you can think of what causes the acid is really the bacteria. When you introduce food or, just existing, bacteria gets into the mouth. And just like how bees manufacture honey, the bacteria manufactures acid. Remember that chalky feeling that you felt earlier? That is what they are doing. That acid is softening the enamel. All right? Now, the bacteria has a different function when it comes on to the gums. It actually infects the gums like how ringworm infects your skin. But instead of ringworm coming on your gum, what actually happens is that you experience bleeding, like my brother Clark, right? Mentioned before. Bleeding, your gums are swollen, they are tender, and sometimes if it gets really bad, you might see pus coming from your gums. All right? And that's when you know you're in trouble. So here we have a diagram, and this diagram shows what periodontitis is. So we have our healthy gums and teeth, and this is like when you've cut. Where's the model? This is like when you've cut, like right here, and you're just looking from sideways. All right. So the bone, if you look at any skull, any model of a skull, you'll see teeth in the skull. So our teeth are anchored into bone. And this bone is supposed to be at a certain level. Now, when you have periodontitis, which is when the bacteria that is infecting your gums start to affect the bone underneath, the bone starts to recede from off the teeth. Do I have a pointer? You're seeing the right. So, we have the bones here. If you notice, where it going? Right. You notice that the bone is at a much lower level and looks a little bit less uniform in the disease state than in the healthy state. And that's what the bacteria does. So earlier, my sister in the lovely dress here said that if you don't brush, you going to, I think you had mentioned that you brush twice per year. And she said, well, if you do that, you might not have any teeth. But how does that work? It's because of the bacteria that affects the bone. So when that bone recedes, it recedes to a point where it cannot hold those teeth, and it falls out. And many persons have the misconception that losing your teeth is a natural part of aging. But that is not the case. If you take care of your teeth, then your teeth will stay. Right, if you take care of you. Right? That is what will happen. You will keep your teeth. All right? So, you see the different manifestations of periodontitis. The reddish gums. Not only are they red, they are swollen. Because what is happening is that the body is initiating some form of immune response. And this immune response, they want to get rid of the bacteria. But because the bacteria is in the gums become a casualty of the war. Right? So, it starts to produce fluid inside, and that is what causes the gum to swell. Two, it's basically like suicide. Right? Also, our gums are not hugging onto our teeth like how I have the mic here. This is not how your gums hug onto your teeth. There is a space in between. Right? That can be measured. And if it's too deep, we know that there's a lot of bone loss. Because when the bone recedes from or is lost from the teeth, the gum goes with it. So the space in between increases as well. Now, there are certain things that might lead to gingivitis and even lead to perio, such as diabetes. Right. Did I mention that perio is a continuation of gingivitis? Did you get that? It's basically an advanced version of gingivitis. Yes, and gingivitis is reversible, right? Periodontitis is not. So that bone will not come back. Your gums, you remember the brushing technique that we used before? That can be used to massage your gums back to health, to some form of health, depending on how bad it is. That is during gingivitis, but with perio now, you can't get that bone to grow back. But you can stop it from receding, right? So when you have conditions such as diabetes and you have to take your diabetes medication, it can cause hormonal imbalances, and that can lead to gingivitis or make you more susceptible to gingivitis. All right? All right, we have.
The Australian Dental Association. Healthy gums should appear pink and firm. They should not bleed during cleaning.
Are we hearing it?
If bacteria are not cleared away from the teeth regularly, the surrounding gums can become inflamed. This is called gingivitis. Explaining gum disease with the Australian Dental Association. Healthy gums should appear pink and firm. They should not bleed during cleaning. If bacteria are not cleared away from the teeth regularly, the surrounding gums can become inflamed. This is called gingivitis. Inflamed gums can appear enlarged, red in colour, and may bleed more easily than healthy gums. Thorough toothbrushing and cleaning between the teeth will help gums with gingivitis return to normal. Cigarette smokers and people with poorly controlled diabetes have a greater risk of developing severe gum disease called periodontitis. Periodontitis causes bone around affected teeth to recede. The gums may recede as well. If the gums don't recede, a space forms called a periodontal pocket. Periodontitis can cause the teeth to move, allowing gaps to form. Treatment from a dentist or periodontal specialist is required. Without treatment, affected teeth may become painful, loose, or even fall out. Cleaning between your teeth is important in preventing and treating gum disease. Your toothbrush cannot reach these areas. And visit your dentist regularly to prevent problems and keep on smiling.
All right. So that basically sums up what we've been discussing. So there's one more thing. As you saw there, healthy gums do not bleed. If you are brushing and you realize that your gums are bleeding, or you're flossing and you realize that your gums are bleeding, if even a little bit, you need to continue to do the good habits of flossing and brushing. So we might not be flossing right now, but if you start and you experience bleeding, you need to continue, because you're actually removing what is causing the bleeding, right? If you continue to floss consistently, after a while, the gums would have had the space to breathe. You have relieved them of that bacterial burden, and now they have time to heal, and so they don't bleed anymore, right? So you continue for 7 to 12 days. After that, well, you continue to floss, but the bleeding should stop by then, all right? So here we have plaque. Okay.
Just adding one more thing to what the video was explaining. They mentioned that the gums should be pink in color. In people of color like ourselves, the gums might not always be pink. They may come in like, a pigmented color or melanated. Yes, I am a person of color. Yes, I am. So you may have like some dark areas on it, which is just your natural pigment. So in people of color, it may not always be pink. That's just one clarification. Okay.
Right. Thank you, Jessica. So, plaque, calculus, and we're going to be sending around a picture of what calculus looks like when it's very bad. Viewer discretion is advised. All right? All right. So we look at this diagram and we see the plaque forming right at that gum line. You remember how we showed you how to brush with the angle of the toothbrush towards the gums. So this is one of the reasons why why we recommend this. While you're looking, you can, please listen. While you're looking, please listen. So you angle the toothbrush at a point so that you can get rid of these. Because if they stay there, when you eat, you are accepting minerals into your mouth. And those minerals, the bacteria benefit from them as well. When they benefit from them, like for example, minerals like calcium, it makes the plaque hard. Because a community of them, and you see this? It's a whole nation of them, multitude of them, bacteria that accumulates in the plaque. And when you mineralize them, when you eat and they get calcium in them, they multiply and they get harder as well. And that now is like the awnings with the wasps. It houses the bacteria, just like the awnings house wasps. Right? So you've seen the picture. You cannot now brush the bacteria that is underneath. Right? Just like how the rain cannot affect the wasp. Right? So they need to come off, and that is why you need to visit your dentist. Another thing is that sometimes you miss places. No matter how good you are, at times you miss some places in your mouth. Sometimes because of the way how your teeth are crowded or whatever, you might have different variations to how your teeth are arranged in your mouth. And you are not able to adequately remove the plaque and the calculus. Well, you can remove calculus, but the plaque, you cannot remove it from the teeth. So that is why you need to visit the dentist. All right? So, yes, you may. Where's the mic? We have 2 questions.
All right, no question. I see somebody teeth, right? They start having some, I don't know if it's black spots. Come on, cheese. Oh God. Black spots between.
Between.
Yeah, like every teeth in the. I was just looking in the person's mouth because I have a problem with mouth. So every time I look at you, I just look in your mouth. That's the first place I look.
No.
I don't even know what you look like, but I look in your mouth. So yeah, but I look at the person and I see all these black spots. Never used to have it, but just between the teeth, like it's brown.
Oh.
Like that dark color between all the teeth. And they look longer than
the teeth look longer.
Yeah, they look longer than usual. So I was wondering what was going on there. I was going to introduce Jessica to the person to get it sorted out. But
well, that might
I don't
be
get
several.
there yet because I didn't want to embarrass the person by suggesting that she should meet with her. But yeah, it
causes
really
that?
look. Yes, so what could cause
All right,
that?
so starting out with the black or the brown spots, right? That could be one of 2 things, because the different stages of calculus, you saw a picture there, the calculus looks kind of yellowish. When it gets to a more advanced stage, it starts to darken as it ages, because these things have ages as well. So the length now, you remember the periodontitis where the bone recedes and it takes the gum with it? So sometimes you see persons, their teeth look a lot longer. It's because the bone would have receded and the gum would have been taken with it. All right? It shrinks around it because the bone doesn't want to have to deal with the bacteria, so it is like it's avoiding it. It's shivering away, it's shrinking away from it. Right? That is periodontitis, and it's an advanced stage. It cannot be reversed in terms of, because when we talk, the difference between gingivitis and periodontitis is gingivitis, it's reversible and it has to do with the gums alone. But there are other tissues, not just the gums, there are other tissues that hold the teeth in place, like your bone. You have something called the cementum and the periodontal ligament, right? These things are what, when the bacteria starts to infect these things, that's when it's called periodontitis. If they have periodontitis, they have to try to arrest it, stop it right in its tracks. It's already gone bad, we can't regrow it unless you have a whole lot of money and you go overseas and they make back your bone. Right, and they make back the bone. That's the option. But we can arrest it, we can stop it from happening, right? And save the teeth that are already there. Alright? You can stop it from progressing. You had a question? Where's the mic?
if you don't visit the dentist 2 times per year, is there something bad with that?
Bad with that? It depends on why. You have some persons like myself who cannot afford to see the dentist twice per year. Right? There are many persons, as a matter of fact, the vast majority of Jamaicans cannot visit. Mm-hmm. Mm-hmm. Mm-hmm.
I just wanted to ask, in terms of how often you need to change your toothbrush. I didn't hear that, so you could mention that.
Okay, all right. So with the what were you asking again? Right, the dental visit. What I would say to you, if you cannot afford it, you're in Mandeville, come and visit us, because it's way cheaper, right? And another thing is you need to practice good oral health habits at home, because here's the thing, it doesn't matter how good a job the dentist does or the dental hygienist does. Majority of what, the status of your mouth is, it has to do with your habits, right? So you have to do what you can. So you have to do what you can. I mean, God hasn't blessed everybody with the financial power to be able to do certain things, but He does bless us with knowledge, right? So we have to use it. So we practice good habits until we can get to a place where we can do this. And guess what? God winks in ignorance. So if He sees that you can't afford it, maybe He might preserve your teeth, in a special way. So about the toothbrush now. You change it generally 2 to 3 months after you would have started using it, or if it begins to fray. And generally it begins to fray when you are too aggressive, right? Even with the soft toothbrush, sometimes we are so avid or so eager to brush, especially the tongue, that sometimes we cut the tongue, cut the gums, and we don't have to. Yeah, like when we're brushing, especially, you see that hard toothbrush? When you use it and you brush that tongue and you're so over eager, it can cut your tongue, sorry. All right, so you change it 2 to 3 months after. Or the sign of changing it as well is, as she said, when the toothbrush bristles begin to look all over the place. Yes. Mm-hmm.
Question.
Where?
You
There's
don't
a
have
question?
the mic.
Okay. All right, we take my
All
sister.
right. So when you eat the sweets, right?
Right.
And you said the acid from whatever you eat is on the teeth, so that cause whatever.
It softens the enamel.
All right.
Mm-hmm.
So if you eat the sweet every day, what is going to happen to the teeth?
If you eat the sweet every day and you do not brush, and when I say brush, it's not that you're going to brush. It's not that you're just going to just brush like that. You have to brush the correct way and you have to brush the correct time. Sometimes we eat the sweetie and we go sleep in the day. Your bacteria loves the warm, dark areas. So even if you're going to sleep in the day, brush. It might. But I mean, they still affect you. They still affect you. The dark, right? Yes. Yes, sir. You can go ahead. And then we have to take my sister.
Yeah, I'm not certain if I heard you mention. Yes, I'm not certain if I heard any of you mention what causes teeth to break. Because sometimes, I think I heard it already that if you have, some people have sharp teeth and some people have, some people teeth tougher than some. Yes, strong teeth. But if your teeth are soft, then you bite on a bone or you bite a piece of cane or something and your teeth break. Yeah.
All right, so remember before we would have mentioned demineralization. Fluoride is a natural component of the teeth. It's like the cement for your teeth. Right? Unlike cement, it can come out after it hardens, after that teeth is formed. And that is what causes the tooth to feel chalky. Another thing is that when children eat the toothpaste, what happens is that too much fluoride is now absorbed into the body. And because the teeth is the main place, and your bones as well, where the fluoride is supposed to end up, it gets up into those permanent teeth that have not come up as yet. So when those baby teeth fall out, and it goes up into those permanent teeth. The teeth are like too strong. Let me give you an example. If you should put a stone on a piece of tissue, it would be easier to break. You'd think that the stone would make the tissue stronger. But actually, because it is so strong and the link between the stones, you getting what I'm saying? I don't think you're getting what I'm saying. But when something is too firm, it cannot bear the weight. And it's a similar, thank you very much. That's the word. It cannot bear the weight. And so what happens is that the structure of the teeth cannot now bear the weight of the pressure. So you eat your dumpling or you eat a cow foot or whatever it is and you bite it, it will crack. All right? So that answers your question? All right. We had a question over here, Sister in White.
I just came inside. I don't know if the question did ask or you speak about it. I know that you're talking about odor for the mouth. Away from your teeth, your tongue, and your gum of bad odor. Can other symptom cause you to have a bad odor coming from your mouth?
Yes, if you have medical conditions. All right. When you have certain diseases that will cause it, like diabetes. Diabetes, especially when you take your diabetes medication, because it causes it affects your hormones. Your hormones become imbalanced, and it can stop your salivary glands. Those are the glands that manufacture your saliva to stop functioning properly. So that causes dry mouth. And that now, because a function of your saliva is to help to rinse your mouth, So if you're not producing too much, if you're not producing the right amount, then it can lead to bad breath. All right?
And sinus can cause it as well if you have sinus coming.
Yes, because what happens is that that's now more bacteria being introduced into your mouth. And it's going to stay on your tongue, right? Because your tongue isn't smooth. It has grooves and little projections that look like fingers. If you take a microscope and look at it. So the bacteria can hide in it like how the cow them around hide in the bush. And, it can cause bad breath. Yeah. Yes, when you finger like projections on it. Mm-hmm. Ulcer? Yes. Mm-hmm. Right.
So another thing that can cause bad breath as well, this is a very common condition that people have in Jamaica, and that's asthma. If you use the asthma pump and stuff very frequently, the medication in there is like the pump and it gets inside your mouth. That also dries out your mouth very often, depending on how often you use it and how often you have the asthma attacks. So that can also cause a dry mouth, and that can also lead to the bad breath as well. So that's another thing that can cause it.
Yes, and my sister, you mentioned before that we don't just brush the teeth and the gums, but we brush the cheek. Not really. You do massage your gums when you brush the correct way, especially after you would have gone to the dentist and they remove the calculus. Like when I always have some analogy, When you put your hand between your socks and it pushes down the socks, your hand is like the calculus and your socks is like the gum. When that is removed, the socks comes back up the foot, right? So in a similar way, the gum comes back over the teeth when you remove that calculus. So you need to massage the gum to help it to come up, right? Another thing, the cheeks, they don't have that. The teeth don't have that, not the teeth, the cheeks don't have that. What should I say? It come back? All right. So unlike your teeth that the bacteria hug on to, because what happens? As soon as you brush your teeth, there is this protein that exists in the mouth that clings on to the teeth, and that is what makes it easy for the bacteria to hang on to it. Your cheeks don't have that. So it doesn't hang on to the bacteria as much unless you have a fungus in your mouth. Right? So you don't need to brush your cheeks. Generally speaking, once you practice good oral health habits, then you won't have that amount of bacteria in your mouth that is going to necessitate for you to do something about your cheeks. Right? And also the mouthwash helps. Right? All right, so periodontitis. final thing on it is that it causes bad breath, as we explained before. Your gums bleed easily. You become extra sensitive to heat and cold. Why? Can anybody tell me why? More of the teeth is exposed. So, because, yes, give him a hand, give him a hand. Yes. So, more of the teeth is exposed, in particular the roots of the teeth. Now, your roots of your teeth are not as hard as outside, right? And it's closer to the nerve. What's it? No. It's actually not as hard as the crown. So, when that is exposed now, it's easier for you to feel stuff. And also tenderness of the gums and pain, because they're swollen, because they're bleeding, they're infected, they are much more sensitive. So when you go to your dentist, and your dentist is doing a very good job at cleaning, but you experience bleeding, it's really because the sensitive gums are being touched, right? It's not that he's cutting your gums or she's cutting your gums, right? So when you go and they're bleeding, it's not because of the instruments. It's really because your gums are so sensitive and weak that when you touch them, like when you brush and it bleeds, it will cause it to bleed. All right? You have a question?
So when I went to the dentist, right, it didn't bleed, But when he finished, I don't know when I scrub so. But when he finished, like I said, 2 days, I couldn't eat no food. Me stress.
All right. Let me tell you. All right, so when you have, for example, calculus, it shields those gums. You see your gums, when you have, you remember the picture that we passed around? Yeah. Those gums are being sheltered like the awnings from the mechanical forces like your toothbrush or so forth. They are already swollen, it's just that you don't notice it. So when you remove that, the contrast between your gums and your teeth is much more evident. So now it seems swollen, and because they don't have the calculus to protect them from the toothbrush, when you touch it, you feel it now, right? So what actually happens is that usually when you have a lot of calculus and it's removed, and you're experiencing that, one solution, well, many solutions, you can swish around warm salt water, or you can get to the doctor and they can prescribe antibiotics, because it's really the bacteria that's causing it. So if we can reduce the bacterial population in the mouth, we can reduce the effects.
So maybe you should explain that to you, because from that, I'm not going to no more dentist.
You need to come to NCU and get it clean. Because we tell you. Yes. Yes, sir.
The last time I went to the dentist, they use a hook stick. And they push it down and they measure 2.5, 1.5. I just that me hear them. It wasn't important.
Okay.
But after they said they're going to clean Mandeville.
They're going to?
Clean Mandeville.
They're going to clean Mandeville?
Yes. I am telling you what I heard. I'm not responsible for what he say. I'm responsible for what I hear. And they say, Mandeville, they go to clean. And they use the little needle and stick me in the gum and say I must wait out. Then my over here becomes heavy.
Oh,
then they turn on a jackhammer in my mouth.
Yes.
They turn on a sander in my mouth. Then a grinder in my mouth.
Wow.
Ring, 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 ring.
Yeah.
And when he finished, he said, I must come back 7 days' time. They're going to do, because according to them, they can do quarter.
Right.
Quarter.
Yes.
And when
and it's the same thing when you went back?
I took the bravery and went back. No, this side here was so numb.
Yeah.
I explained it to him. He said, go home. Use hydrogen peroxide. Show 7 to 1.
The proportion?
7 to 1.
7 what?
7 drop to 1 hydrogen peroxide and ring. It wasn't working.
Okay.
Go back, he said use warm water and salt.
Right.
And it wasn't working. And up to now, I have not returned to dentist. Because I am scared of them like yesterday.
What do you say you were experiencing? swelling.
Yeah, it was so numb, so tender that even if I drink room temperature water, when I touch it, cool.
Mm-hmm.
Because he went inside there with jackhammer, sander, and plane.
All right, let me translate. So that needle, first of all, they said that they were measuring something. That's called a periodontal probe. You remember those pockets that we spoke about earlier? We have to measure it because depending on how deep those are, that tells us how bad. Well, it gives an indication. It doesn't tell the full story, but it gives an indication as to how far the bone has receded and took the gum with it. You said that the next thing they took a needle and stick you. That's something that is supposed to take away the pain. Right? That needle is anesthetic, but it's local anesthetic. It's not cocaine. It's a different thing known as lidocaine. Lidocaine is the widely used one now. And it's not Novocaine. Many Puritans are familiar with that. It's not that anymore. We don't use Novocaine anymore. We don't use cocaine anymore. It's lidocaine. Right? No, man, it's a different thing. It's a different compound. No. The thing is, you see, with the Novocaine and the cocaine, they found that it was causing a lot of allergic reactions in the mouth and addiction as well. So they had to make some different compounds, like lidocaine, like prilocaine, mepivacaine, right. So all of these things. Repeat? Right. So that is supposed to take away the pain because they're going below the gum line. That can be painful, so they need to get rid of that.
It is so important that they educate us when they are doing what they're doing. We come to you, we don't know what we're doing.
Right.
So just explain to me, say, well, sir, based on what is happening, we have a challenge here because it seems that you need additional help and we have to do this and we have to do that in order to accomplish this. You know, so I think it's so important when we come, people explain.
Okay, so to expound on what Sister Cecile was saying, yes, it is important that they do explain because it kind of leaves you in the dark and you're not sure really what's going on. Yeah, and you don't know what to expect because it just kind of, they leave it there to kind of figure it out yourself. But usually, if you come to NCU Dental Hygiene Clinic, we explain everything to you. We're going to explain, hey, you're going to need anesthesia because of XY reason. And then this part of your mouth is going to feel numb. It'll feel numb for however long it's supposed to stay numb for. And we tell you all the side effects of it, what could possibly happen after we inject it and all of that. So we usually explain all of those things to you. That's why we recommend you come to NCU Dental Hygiene Clinic, make your appointments. Mm-hmm.
No, we've always been explaining. NCO, you went? You went? Is a new crop of students in evolution has arrived. Yeah? Same teachers. But how could we be explaining this now to you? And come on. Make an appointment.
Okay. So, okay. Hold on.
We have a question over there.
One at a time.
We'll allow him and then we'll take your
Okay, so Brother Trevor, ask your question first. How do you apply the... Use the mic. Use the mic, please. Yeah.
You know, okay. The application for the substitute for cocaine, is it 2 needles just the same way? And next thing, is it more pleasant to do a root canal?
Okay.
Or same painful?
With the cocaine thing, no. We don't use cocaine at all. At all. We do not use it. None of it. Because during studies from way back in the day, they realized, oh yeah, it's very addictive and whatever. Because when that's the first thing they figured out that, releases sensation of pain, that's just what they use. But now we have all these new technologies and stuff like that so that we don't have to use that anymore. So we do not use it, period.
So therefore, it is more easier to apply and it's easier for us to do a root canal after using it.
So yeah, so with the ones we use now, it's much easier for you to not feel any pain when we do like root canals and do the periodontal treatments and cleanings and whatever. Yeah. Oh, brother.
Two things. One, I'm asking the question You're saying that because you're explaining, I think this is just because it's an AY program, or maybe if you go to lecture somewhere, you say that. But the lecturer that teaches you dentistry or dental hygiene, isn't the same teachers that always been there? I'm just asking.
I don't know. It depends on when he went in.
Okay, all right.
It depends.
Okay,
It
all right,
depends
very
on who you
good.
went to.
The other
because
thing.
most of them are new.
The other thing is I almost forget. The thing that you use, what we call licocaine or phycocaine or medocaine or whatever cane. You are using that because it is what? Easier or less effective, or in terms of?
It's more effective. And it's safer.
Okay.
Because just as Mr. Anderson is saying, when all the calculus and stuff gets underneath the gum line and stuff, you don't want us using our instruments and going in there without any way for you not to feel the pain.
All right.
Because it's going to be
okay,
extremely
very good.
painful.
I remember what I was about to say. But the thing I was about to say was that the folks who, when you go to them, because I went to one and they did the same thing. It was an NCU anyway, but they did not explain anything, but they just turn on those machines in the mouth, as Brother Murray was saying, and when you finish, I couldn't eat for days. Because they don't explain anything until they say, well, then, boy, they're going to remove this and they have to do this. And I believe they are doing it because they want you to come back. They doesn't tell you anything. All they do, come back the next 7 days because they want more money. And them, I wreck you. So you can, because I couldn't even eat porridge for me, but I think about 2 days. Even if I drink water, it's like my mouth was inflamed.
Yeah, I'm sorry.
So, no, you don't understand, Brother Trevor. You don't teeth. All right, so they need to explain. I'm happy for what you guys are doing, and I hope you continue that way. And when you're doing your practice, you'll do just like what you're doing here and now. All right? Very
So
good.
I'll give you a realistic answer to that as to why some of them do not explain. They work on a time constraint, a lot of them do. So for them, it's really, you have to work fast, want to make the money right now. Not NCU though, we take our time. We take our time. And we explain everything to you. At NCU. On East Campus, the other side. Over nursing. We're over there. Yeah, we have the big old sign over the front door. Visit anytime, make an appointment. Oh, that was Mandeville Clinic, not us. Yeah, same location. Okay, I'll give you all those details after. I'll give you all those after. Right, so the basic answer as to why they don't explain is because they work on a time constraint and they need to make the money now, get you in and out, ray. So that's why most of them do not explain. Even though it's not very nice for them to do, that is why they do it. That's the realistic answer.
And I want to add to that, there are professionals who work under time constraint that still find the time to educate, because we're dealing with persons, we're not just dealing with a mouth. So we have to find the time. When you go to a practice, we can even give you afterward, but we have to explain. That is an important part of education, is an important part. So we have to find the time. And if you don't see them telling you, you have more information now, what do you do? Now you can ask certain questions. Yes. Any other questions?
Yes. After. So finish up your...
Yes.
Okay, so finish up your thing.
Right.
Okay, so finish.
All right. We would have explained this already.
Skip that, just skip that.
No, skip. All right.
Okay, so seeing as the sun has set, we're going to try and go through this quickly. So for our music session, this is a fun little activity. Remember at the beginning of the program I say, you have to listen so that when we come to the end for our activity. What's your name? Miss Law? I saw Miss Law taking notes. throughout the program. So I know that Miss Law is well equipped to participate in this activity, and I hope for everybody who didn't take notes, you are making mental notes so you're able to not only be educated, but you can participate in our activity. So for our music session, what we want you to do, so ideally we would want to split you guys into 2 groups, but for the sake of time and the amount of people, we are going to allow you to be one big group, and we want you to create a song to the tune of a hymnal song that we will provide, and using a little bit of the information you learned today, so not all of it. And you just want to, so each song should have at least 1 verse and a chorus, not a 2-minute song, just a 1-minute song. A verse and a chorus, and then you're going to put it to the tune of Whiter Than Snow. You know Whiter Than Snow? Yes, so the song that you're going to do is to the tune of Whiter Than Snow. You have 7 minutes to write this song. So, 7 minutes to write the song and come and perform it.
Just the verse and the chorus.
No, pardon? You guys can gather over there to. The timer will alarm when your time is up, and when the time is up, please come and present. You have 2 minutes remaining. You finished? All right. Whoa, you guys work so fast. 5 minutes. Okay, so you guys can come ahead and present your song to us. Tell us the title. And go ahead and sing your song.
Come, Mama. Lord Jesus, I long to have perfect white teeth. Lord, help me to brush and floss 3 times a day. Remove all the plaque and bacteria too. Lord, help me to clean my teeth 3 times a day. Whiter than snow, yes, no gingivitis, no periodontitis, it shall be whiter than snow.
Okay, so we are going to let you hear 2 songs that another church that we went to and did the presentation came up with.
After 2, 1, 2. If I don't brush my teeth, if I don't use mouthwash, if I don't floss my teeth, if my brush is not soft, I'll get gingivitis or periodontitis. I lose all my teeth and I can't grow them back. Oral hygiene, yes, oral hygiene. Brush, floss, and repeat for oral hygiene.
And then this is the Okay. Play your own? All right.
Jesus, I long to have perfect white teeth. Lord, help me to brush and floss 3 times a day. Remove all the plaque and bacteria too. Lord, help me to clean my teeth 3 times a day. Whiter than snow, yes, no gingivitis, no periodontitis, it shall be whiter than snow.
Okay, so that was really good. So next time we go to another church, we'll play your song for them. Okay, so do you guys have any questions? Well, we asked questions through the entire presentation. So for your dental, yes, the time is up. Go ahead. When you're coming back? Okay, so as soon as you guys, whenever you guys want us to come, during the school year, of course, because in summer we're, away. Whenever you can promote it and just send it to Jessica. Tell Jessica when you want us to come, when you have a full house, and we will make ourselves available. Yes, and you can invite your community members and so on and so forth. Yes, so for your dental appointments, visit us at the NCU Dental Clinic to have dental cleanings, x-rays, fluoride treatments, and more. We are now accepting patients, and for more information or to set an appointment, you can take down this number, or you can see us immediately after to set your appointment. 876-783-6925. That's 876-783-6925. And you can just say your name and say that you're interested in setting a dental appointment. Okay, so thank you guys for listening. Go ahead. Oh, yes. The price ranges. Yes. So off the air, when you were wrapped up here, you guys can come to us and we'll let you know, give you a special deal. So thank you guys for listening, and thank you so much for having us. We felt right at home, and we do hope to see you guys again very, very soon, whether it is here or at our dental clinic in our dental chairs.
All right. We are grateful, extremely grateful. Though few, we are grateful. I would have learned a lot this evening. I'm asking all the team to bring themselves back on stage. Yes. The amazing thing about this team, is that it's a team of young people. And we should applaud young people who are being productive and contributing to society. They could be elsewhere, but they find themselves in church. And this, of course, is a ministry. This is not just going about and giving information. So I want to commend you guys. You did very well. And of course, looking forward to great things from this team. You are bright people. Bright people having excellent command of your content, understanding, answering the questions in a very competent manner. Yes. And they have not finished their program as yet. So there is more to learn. We're very, very proud of you, young people. Keep doing what you're doing. We have a gift. Not sure how the gift is going to be shared, because we were expecting one presenter. We're expecting one presenter, as is typical with these presentations. But we have a team, so we owe you some stuff when you come back. We say when you come back. Yes. Right. So thank you very much, guys. Thank you very much for coming out. And we wish you well in your endeavors, in your professional life, and in your walk with Christ as well. Keep your ministry going. Thank you very much.
Thank you. Thank you so much for having us. We really do appreciate it, and we will be back. Yes. And of course, remember to set your appointments when we're through here.
I also like to thank the team for coming out, and to let you know that I am working at NCU before you all were born. The department that you're working in, half of the facilities there was put in by me and connected by Brother Lewis and maintained by us. So what you see there, I am the one, Brother Lewis is the one also. But I'm telling you, I am very happy and proud of you all. For a person to go through their content like that tells me that you guys have learned well. And I am very proud of you. With our heads bowed and our eyes closed and our heart turned heaven already. Most kind and loving Father, we thank you for today. We thank you for these young people. Lord, you say you call upon young people because they are strong. but into your hands I commit each and every one of them. That as they go about studying, as they move on from study into the work field, that you may continue to guide and to protect them. That they will not turn to the left nor to the right, but they will hear a voice saying, this is the way, walk therein. So as we entered into this new week with new hope, new challenges, we know that we cannot do it of our own, but we put our trust in you. So we ask of you, Lord, that the words of our mouth and the meditation of our hearts will be acceptable in your sight. O Lord, our strength and our Redeemer. Amen and amen. Have a God-blessed weekend.